So what we're going to do tonight is really make sure that you are getting off on the right foot, even if this is not your first time studying. Because sometimes when we study and we don't study within our learning style, or sometimes we just need something different, something new. And so I want to present some suggestions for you. We'll talk about some resources. And then, of course, we'll talk about how to craft a study plan. So if you signed up for the class, then you have access to all of those documents that I sent out. And so make sure that you are able to take those quizzes and assessments that were on there. That's really important because you want to know what your learning style is and you want to know what your level of anxiety is. It's really focused more on test anxiety because it's important for you to know what your levels are. Are there anybody that is new to me and the class? Let me know in the chat. Also, oh, you're new to the class? Welcome, welcome. Hey, hey. You are new, you are new. Yeah, sorry. Normally we do not have technical difficulties like that. So sorry about that. But my name is Dr. Sapphire Boone. I'm the owner of Advanced Social Work Solutions. And my focus is to really help you break down the exam and understand what your role is and how to make it a little easier for you. Nice, nice. So a little bit about the exam. I'm going to go through this quickly because most of you probably understand this information, but 170 multiple choice questions, 20 are unscored. Okay, so that's the setup. And then in terms of the scoring, of course, you don't know what your score is when you go into the exam. You won't know until they give you the printout. But the scoring ranges 90 to 107. 90 meaning your test was harder, and so you needed less to pass. 107, the thought process is that it is easier, and so therefore you need more questions right because your questions were quote unquote easier. Most of the scores I've seen is like 100, 101, 99, 98 in that range. I have seen where it was a 95. So by theory, your test was a little harder, right? And so you want to, I wouldn't worry about that part. I know we get caught up on the numbers, but I wouldn't worry about that part. You do have 4 hours. You can get an accommodation to extend your time. However, when you get an accommodation, it is a little bit I wouldn't say a barrier, but they do make you jump through a little bit of hoops to get the accommodation. And so if you're already scheduled for the exam, you do have to reschedule it with that accommodation already being approved. And that last time I checked, it did have a fee attached to it if you were already scheduled, and then they had to schedule you again with the accommodation. So things to keep in mind. I also linked the new information about PSI, which is our new software and exam administration that they are using and contracting with. And the examination guidebook also gives you more information about that as well. Okay, the first thing to do is to set a date. I know that we like to study without a date in mind, and we like to just say, well, I'm going to get into the routine and then I'll figure it out after that. But that typically does not work. Because for me, and this is my just suggestion, setting a date makes it a little bit more real. It does have a little anxiety attached to it. Can anybody relate to that? Where are you in the process? Have you set your date? Or are you in the stage? And the hesitation stage is fine. It may be because you had a past attempt and wasn't successful, or this could be your first attempt and you're just so scared that you don't want to set your date. So tell me kind of where are you with it? Are you on track? Okay, we got some set dates. Okay, okay, in the yes. So awaiting your final approval, so wanting to get started, so that once you get approved, you can hit the ground running. Okay, haven't taken it in a year and a half. Yeah, so a little hesitation there. No debt, yeah, no date yet. Yes. Study, then fall off. Yeah. Submitting paperwork soon. Okay, great. Date set. Yes. And the reason I say that that's important because I want everybody to be in my study groups because I think they're bomb. But honestly, if you're in the study groups and you're not seriously studying to test, then what ends up happening is you're on fire for this 8 weeks or 10 weeks that we meet together. And then if you're not like testing within like the month after we finish, then it's like, well, then what do you do after that? Right. So you're kind of like in a limbo. And so sometimes it can be that way. So I'm glad to see that some have set your date. Has anyone did their learning style quiz and tell me what you think about it? Sorry, just have to end my screen share just for a second, but tell me in the chat, think about your learning style. Tell me what you think your learning style is. Did you take the quiz? Is your learning style a different style? Tell me a little bit about your learning style and kind of how you use that knowledge in order to study. Okay, you're a visual learner. Even if you haven't taken the quiz yet, what do you think you are? And what is your plan for studying? If you haven't taken the quiz yet, I do recommend it because sometimes it falls in line with what you think, and then sometimes it's a little bit opposite of what you think. I'm not sure. There we go. Okay, more of a visual learner, visual, auditory. Okay, visual and hands-on. So far, if I'm mobile, I've been listening. Okay. When I'm sitting time, I'm taking notes. Okay. Yeah, so you might be a mixture of both. What I found was that some people thought that studying meant reading a study guide and just sitting there reading it, taking notes, and highlighting. And that's great. But because we have so much more technology, there are many ways for you to study. And I'm a visual learner, so those traditional ways of studying work for me, but it doesn't work for everyone. And it's really important that you know what works for you because what works for me or what works for another person is not going to work for you. So you really got to make sure that you are doing what works for you. And it's so hard because you want to compare yourself, or you want to be like, well, what did you do? It can help me, and some things can be helpful and then other things can be not helpful because now you're trying to force yourself to do something that somebody's told you to do but it's not for you, right? So you want to make sure that it's personalized for you is going to be really, really important and key to your study journey. One thing, a hack that is really good, I haven't tried it yet, but it's the screen reader. I think it's in Adobe. So you can have material and have it read it to you. So for instance, if you have a study guide on a PDF, you can have it read back to you. So that's something that you can do. You can have notes that you typed up, put it in a PDF, and then have it read it back to you. Okay. Or notes that someone else took. Like I forget who mentioned it in the chat. But you could also do a podcast. Agents of Change has a great podcast to listen to. So you have YouTube. So you have so many different things. And for my hands-on learners, you are going to use practice questions, okay? And you're also going to use scenarios. This is how you can use, and I really need to do a whole class on this, but this is how you can use Chat GPT for your studying. It's been really helpful in terms of me creating some content for questions, right? So it's really good with specific things. Like if you say, hey, make me a study guide for the exam. I don't know. I haven't tried that yet, but it might bring up stuff. It might not. I don't know. But what you can do is ask it for very specific things. So if you're like, hey, tell me what DBT is, what it's used for, what is it commonly used for, and tell me what the difference is between that and another therapy, right? So if you're getting stuck, it's really good. So for my hands-on learners, you need application, you need scenarios. And so sometimes study material has scenarios and sometimes it doesn't. So what you could do is say, please give me 3 scenarios. You could let it know that you're studying for the ASWB social work exam, right? Give it that. And say, hey, can you give me 3 scenarios about this technique or this definition? It would be great for defense mechanisms if you need more examples of those. So use the tools you have, okay? Some people are fans of AI, some people aren't. AI is not smart. So for example, I've tried many times for it to give me some practice questions that were good, and none of them are good. Even when I tell it, hey, give me a scenario and then give me set it up like the style up, it's not going to do it. So it can't be a study coach for you, but it can really help you with simple things like definitions. It does really good with compare and contrast these two concepts, does good with that. You might can say, hey, I want to study, you could, this is a good thing. I haven't tried this yet. In terms of your study plan, you could, and let me know if you like AI or you don't, because maybe this is not helpful. But for me, I love ChatGPT. What you could do was copy and paste the ASWB content outline and then tell it to give you a study plan. Like say I think it's, let's see, I don't know. Oh, June 29th. Say June 29th is my test date. Can you please break this content outline down for how many times I should study per week and give me a weekly schedule of what to study based on the content outline, and it'll spit it down in 3 seconds. It's a good tool to start. So it might not be like the order that you want it in, but it may be very helpful to say, okay, Monday, I'm going to study defense mechanisms. Tuesday, I'm going to study this. Like it would be good for that, I think. But okay, nobody said they like AI, so let's move on. But it's really important for you to know what your learning style is, in order to capitalize off of it and to make sure that you're considering your unique needs. Oh, you love AI. Okay, I got one person. Yeah. So you want to make sure, that's really what I want you to take away, is that you are doing it for your unique needs. And that's going to be key as well. Okay, we have a question. How much time after getting your degree can you schedule your test? So, great question, Jenny. And that's going to be up to your jurisdiction. I'm not sure what state you're in. But in Maryland, you can test before you graduate the same semester that you graduate. But in other states, it may be different. So, anytime you have specific questions, you want to go to your Board of Social Work. Sometimes it's housed within your larger Department of Health, and then sometimes it has its own website and board website. So you just want to look up your social work board, and it should give you information about those types of specifics that way. And if you have any information or questions about that, I may can help you. New York does not allow, but okay, New Jersey allows you to test before you graduate. Yeah. So you just want to make sure you know all of those things. Another thing that's happening, I'm not going to share my political stance on it, but there is the compact that's happening. So you want to get some information on that. It's going to be extra money and you have to take the exam. So have feelings about it, but we're going to talk about how to study. Do you think they will ever get rid of the LMSW in Maryland? I'm going to say possibly. I'm going to say I hope so, but I don't know. I don't know. There's buzz around it. It's buzz. It's a buzz and it's hopeful. I hope. I got the Don Apgar book. It is really helping. Yeah. Don Apgar is the most affordable option. You have a couple options when you go on Amazon, put in Don Apgar, you're going to see the different options, right? You want to make sure that you have the right exam level is number one. Number two, you can get the guide by itself, or you can get the guide with the bundle where it has the book for the guide, and then it has a smaller book that has the test questions in it. So with that bundle, you get 2 full practice exams. So it's the most affordable option in terms of a study guide. And so definitely, recommend it. Also, it has app access. So just keep that in mind that if you're getting a generation, that's not what I was saying, a book from another person that already bought it, like if you're repurchasing it, just know that the app access may not be active. Because once you activate it, I think you have 6 months to use it. And so, just for your information. So it's the most affordable option. You do have also Leap is another one that I really like. And it has multiple various ways of studying. So it's not just a study guide, although they have a study guide, but it also has audio practice exams. So if you're looking for a practice exam, it has that and other things added to it. And then Therapist Development Center, these are not in order. But the Therapist Development Center is more of a structured program. So they don't offer things a la carte. It's one whole program. And it is a fan favorite, I would say, fan favorite. So my material complements any of these. If you're using my material, do you need Don Apgar or do you need any study guide material? I would say it depends on who and how you study. Some people like to have a encyclopedia, if you will, of the exam and like to be able to reference it. So it depends. Like if you're more of a tangible, I need to see something, because my material is online. So if you want like a tangible thing that you can like ruffle through, then you can buy things, or you can just ask someone if they have books that you can use or whatever, or ask your job to buy it. um but the other thing you want to keep in mind, so it's up to you, but there are so many free options that do I think you must buy a study guide? No. Just because like I said, it's so many different things out there. But again, sometimes it's good just to have a reference. And sometimes you can find some files of various different materials. So, if you want to be resourceful and find those things, you can. but I wouldn't say that you have to, but it also complements all of these very well because my material is going to break down your what you need to know. So it's not going to have everything in it. Someone told me, well, many people told me that I need to write my own study guide. So I'm not there yet. And so my materials is it's not a study book, right? It's more about, hey, this is what you need to know. Here's how to break down the information you need to know. But there's going to be things that's not in there, right? So if you want to buy a book just to see what else they cover, that's fine. But again, you can always find the information. And I try to keep it current in terms of the hot topics that you need to know, making sure to update them as things are changing to make sure that you are, really with the hot topics. So, for example, if we go over, for example, Jessel has therapies. There's a whole thing. I don't go into depth about Jessel in my materials, but I mention it and let you know, hey, it's a hot topic, right? So that might be something that you look more into so that you can take your notes or have I give you some notes, but so that you can take more in-depth notes about what these different terms are, making sure you have a good grasp about that theory or that therapy, right? So it's fine to have supplemental resources to get the information you need for that. So I hope that answers your question. Okay. So after you figure out what materials you're going to use, and of course, like I said, I have an online study course. Right now it is $79, and it includes all of the study groups as well. So that you can use my program, you can use any of those kind of traditional study materials as well. You want to transfer the study material in your learning style. Now, most of the programs are going to be like that. So if we go back, Therapist Development Center is going to be more auditory because it's audio, but it's also visual because they do have handouts and things to print out as well. Dawn Apgar is going to be more visual, right? And then Leap has different various products that would hit all of your learning styles. And there are more than the three I just named. There are a lot more. And there are some free ones that we're going to talk about a little later. But there are a lot more that you can either purchase or look more into. What I would say about you don't want to use everything, right? You don't want to use I'm going to use this and I'm going to use this, I'm going to use this, right? But if you're on a topic, I would say it's okay to use multiple resources if you're trying to gain an understanding on a certain topic. I think that's fine. So transfer the material in your learning style. Again, most of the programs and things are going to already be in possibly your learning style. If we didn't have YouTube, I would say that you can record yourself and then listen back to it. But because we have YouTube, you can probably find a video on whatever the concept is that you're trying to study. Then you want to review study questions. You want to review your study questions. If you're within a month of your test, you want to start taking full practice tests to give you that exposure to sitting for 4 hours. I also do recommend the ASWB full practice exam 2 to 3 weeks before your test date. The reason I recommend it, I know it's extra money, but the reason I recommend it is because it is retired questions from the exam. And so you can't really get any closer to what the questions, not what they will be, but what they will be like, right? And please, hear me when I say that the practice exam is not a direct correlation to how you will do. So I've had people that failed it by a couple points and passed the real exam. I've had people that passed the practice exam with flying colors, like high scores, and then didn't do as well on the exam, probably because of anxiety, right? So there are some factors, of course, that on test day, it's hard to mimic, right? As much as times as you take it, it's nothing like taking the real thing because you know it's the real thing, right? And so making sure you're addressing your anxiety is also something I would suggest, and we're going to go over as well. Do you suggest taking it if you have already taken it once before? I would say depends. I would say depends. If you have, what do I want to say? If you forgot what the questions are, so let's say you took the practice exam 5 years ago. If you want to repurchase it, you can. But just know it's the same exact practice exam that it was 5 years ago. If you're like me and you memorized all the questions, and so if you see them again, you would automatically know the answer, or you would automatically recognize that you've seen the question before, then I wouldn't. But I've had clients that even though they took it like 6 months ago, they repurchased it again just because they wanted to. And that was totally up to them. That's fine. I had another question just for clarity. The live classes and your study material are two different prices. Good question. So they are two different prices. However, I am running a buy one, get one free deal. So if you buy the replay bundle for $79, you get all 6 classes for free. The reason that I have a separate price for the live study groups is that sometimes I have clients that already purchased my replay bundle, or I have clients that they don't do well with an online setting and they don't want it. So that's why I have 2 different prices. So if you buy the replay bundle, you get all the classes for free. So it's a great deal. If you just want the classes by yourself, you don't want the online course, it is $99. If you bought the replay bundle before, or you bought all the classes before, but you still want to be in all of the classes, then the price would be $69, and you just have to email me to give you the discount code for all the classes. Do you provide one-on-one in person? I do not. I cannot provide one-on-one at this time just because of my scheduling. I don't have time. So that's why I do the group classes. And I can assure you, besides the individual attention, I can't give you individual attention. But the material, literally, because I started out doing one-on-one tutoring. That's how I started. And the same exact material that I use is the same exact material that I give out in the study group. The study group is good because at least I know that you did your homework, because we do it in class. We do it live together versus the one-on-one. We may meet for an hour, but then I tell you to do something. I don't know if you did it. But in the live study group, even though it's a group of us, we're going through it together to ensure that you are really getting the material you need to get. And then, making sure that you're able to break down the questions. And that is really my specialty, is breaking down the questions, making sure you understand how they look, what to look for, and how to answer the crazy, I shouldn't say crazy, how to answer the complicated questions that come up. So I'm going to help you with that. Okay, your study plan. I have a great document. It's called Study Plan. And I love that at the end, there's a weekly kind of planner. I just got it off of the internet, just a regular weekly planner. But I want you to print them out if you're visual. I want you to print them out and fill it in for what you're going to study this week. Even if you only study once a week, or even if you just study twice a week, when are you going to study that? Is it going to be on Monday? Is it going to be Saturday? So when are you going to study? And then what are you going to study? And not only what day, but what time of the day works best for you, right? So think back to, if you're in school, think back to, yesterday. Or if it's been a while since you've been in school, think back to when are you most productive? Even on your job, when are you most productive? What setting do you need? Do you need to be at a desk sitting upright? Or can you study in the bed, right? So think about all of those things to maximize your study time. Also, if you're a hands-on learner and really just anybody that is good at multitasking, if multitasking is good for you, then sometimes you want to study while you're doing things. So you could be cooking and studying, right? Because you're listening while you're cooking. Obviously, if you're driving, you want to do so safely, but you could be listening just like you listen to the radio. You can be listening to those podcasts, listening to YouTube. On YouTube, you can set up a playlist. Okay, so you can do that. Set up a playlist and just let it play out. So you could do that. So just different ways that you can maximize your studying. I saw somebody said when they're on the go, right? So have study materials that you can access on the go, right? Because you're not always just sitting there. The other thing I always tell people is, how invested is your job into your growth and development, right? Because a lot of jobs will pay for me. Ask them. They may pay for the program. They may pay for your study materials. They may pay for you to take the exam. If they don't do anything, if they don't give you any kind of financial thing, what my supervisor did is she allowed me to take agency time to study. So she would say, go home and study, right? So sometimes I know you don't want to tell people you are trying to take the exam, and, use your discretion. Some supervisors, if you give them that information, they'll, abuse it and try to sabotage you, right? Give you more work and stuff like that. So if you have a mean supervisor, don't tell them. But if you have someone at your job that allows you to, you need help and support, right? So if you're able to do that at the job, I'm not saying, risk or put your clients at risk or anything like that. But if you're able to do that, I know when I was taking my master's, I would come in an hour earlier and then study the exam for that hour at my desk in the office, because it was helpful. And then I would just go straight into my work and do it like that. So definitely ask. Yeah, my supervisor just asked me how she could help. Yeah. So yes, if you have a good supervisor, see if they'll give you a little time. But, do it with discretion. You don't want to offend them and be like, how dare you ask me to, but just see. Or in supervision, you can actually ask your supervisor to use, even if it's 10 minutes, the first 10 minutes of your supervision time, to go over licensure prep stuff. So supervisors are really good with connecting what you're currently doing to concepts. And this is good for your learning. It may not be good for how to break down questions, because we know that our experience sometimes can cloud it. But in terms of remembering, if you're hands-on and you need those live scenarios to apply what you're learning so that you can remember it, then supervisors are really good with that too. So ask them if they will take a few minutes, just to help you see if any of those things are in there. Because sometimes companies do have professional development monies, but they don't tell you that they have them, and they're not advertising and saying, well, do you need us to pay for your stuff? Do you need, so, but ask them. They may be able to. Then we have, I do have a sample study plan. What I would say start with, and this is even if you're restarting, the code of ethics is great to start with, because the code of ethics, it's not, I wouldn't say it's 100% concrete, but it's probably the most concrete thing you're going to get out of this study journey. Some of the other concepts may be a little gray. When do I do this? When do I do that? But the code of ethics is really a foundation of the study journey. So you want to definitely start there. Even if read it 5 million times, maybe this time listen to a YouTube on it instead. So it's just different ways. What I suggest is that you do study a topic within its entirety as much as you can, right? So obviously you're not going to be able to do 100% of everything, but don't say Monday I'm doing code of ethics, Tuesday I'm doing whatever pops up on my YouTube. Right? And we're all guilty of it. We go on YouTube for one thing, and the next thing we know, 3 hours later, we've looked at all these different videos that had nothing to do with each other. So we listened, but we really didn't learn much, right? So I want you to be a little bit more intentional about how you're studying. I also want you to address your anxiety as it comes up, right? So if you get anxiety, well, first, let me ask this question. How many get anxiety before they start studying? Definitely me. Because now you're like putting your body, it's like your whole body like changes, right? You get a little bit of your heart starts beating. You kind of get nervous. Depending on how your nerves come out, it'll be different, right? And so you want to be able to address it. I've had clients when I used to do my one-on-one and just talking with clients, I've had social workers that just by the mere, yes, I was just about to say that. Just by talking about the exam, not even studying, not even doing questions, they start to have a reaction. Okay. I've been doing a lot of university preps. One of my university prep, just doing they were nervous to do a question, right? Because it's like, oh my gosh, I'm worried about getting it wrong. Or when you're studying, you're like, oh my gosh, how am I going to remember this? Am I ever going to remember anything I studied? Am I ever going to pass this thing? Right. So all of those thoughts are coming to your mind. And so a lot of you preparing is preparing for those moments as well. So when you get like that, how do you react? Right. And so I do have, you can review this. This is just giving you different topics, but mindset is big because this is a great segue into mindset. You have to be able to address it. I can't really emphasize it enough. It's one of those factors that are a little bit harder to control, right? Because you could have all the strategy, you could have all the knowledge, and then the anxiety may still overwhelm you. So even if you don't have all the knowledge, even if you have, well, you do need a good strategy, but even if you don't know how to break down every single type of question, if you're able to master your anxiety, you are going to be setting yourself up way better than if you're not. Right? I need to be able to stay calm for 4 hours. Yeah, and guess what? Your anxiety is going to be there. So I'm not saying that you're going to be anxiety free for 4 hours, but what I am saying is that you need a plan of attack to how can I calm myself down in the moment? When I'm under pressure, what works for me, right? And so you want to establish those routines every time you study. So for me, what I did, and what I can include in the follow-up email when I send you the recording, is I use the Bible, scripture, right? That's what I did. I'm not suggesting anybody else do it, but that's what I did. I found some ones that really spoke to me, and then I read them before every study session. Because for me, and even if you're not a religious or spiritual person, this exam is more than just an exam, right? Because of some political things that have happened to get us to this point, right? This exam is like represents our career almost. And the journey to get to that other side of passing is really just as personal as it is professional. It's actually probably more personal than it is professional, because in my journey, I had to master my perfectionism that I'm still working on in therapy. Okay. I had to, because it's so personal. It is, Monique. It's so personal because let me tell you, the thought that you aren't good enough, right? So if you have had a failed attempt, that failed attempt in your mind could have represented, I'm a failure. I'm not good enough. I'm not a good social worker. Um, I'm not smart enough, right? All of those things. Yeah, all of those things are coming in your mind. And I'm actually getting a little emotional because the only reason I'm getting emotional is because I don't want anybody to feel that way, right? We've all felt that way, even if it's not about the exam. You felt you're not good enough before. You felt that before. So you have to get a handle on that because you are good enough. And that imposter syndrome that you're continuing to feel for yourself, you have to be able to overcome it. And yeah, you do. You cry. Yes, you do. You cry thinking about it. Yes, I'm crying with you. Why am I crying? I don't know. But I just hate it. I hate it. I hate that part about it because um you are enough, and the exam has blocked so many, in particular Black social workers, from being a social worker. And I believe it was set up that way. I do. And so the fact that this exam can do that to someone, break someone down like that, I hate that. And that's why, honestly, I am dedicated to helping, because I don't want people to feel like that. We shouldn't have to feel like that just to be a part of social work, right? And so that's why I want to help, because I don't want people to feel like that. But it hurts me because sometimes no, because sometimes it hurts me because sometimes I don't know how to get you to not feel that way, right? So it's like I'm giving you all the strategies. We're talking about, Freud and all this stuff, how to strategize with the exam, but then it's that anxiety and you're having issues with it and it's coming up for you. And sometimes it's a hard conversation because sometimes there may need to be some more clinical interventions that need to be had. That's tough too. When I'm like, well, have you thought about therapy? Have you thought about like different ways, different interventions for your test anxiety? Because honestly, we just think, oh, it's normal. And so we just have to deal with it. We have to like figure it out. But sometimes it is some more things that could happen that could really help you. But it's like all of that, like you feel like you're a failure. Then you're telling me I have to like go to therapy to fix it. So it's just like all of that. Yeah, it's old feelings and it's real feelings. It's real feelings. And I feel like you can't talk about the exam without talking about this. Yeah, it's so yes, it's that yep, deafening, it's defeating. Yeah, it's all of that. It's all of that. Yeah, yep, you do questions and it's like, yes, you're like right back in the exam. You're second guessing yourself. And so I say all that to say that I really want you to be dedicated and committed to overcoming that. And it looks different for each person. Yeah, it's expensive to keep taking it over again. Yeah. It looks different for each person. So I want you to, as much as I want you to do the academic side of the exam and I want you to learn everything and I want you to, as much as I want you to do that, I also want you to know how to tap into the test anxiety part. I do. So okay. So your test anxiety is showing up because like this, right? Fear of taking the exam, worrying about not remembering, You're having physical symptoms, right? Restlessness, tiredness, shakiness, palpitations, shortness of breath. Um, and actually, I have a colleague that does brain spotting for test anxiety. So I would say just be open to addressing it. As much as you want to study, I want you to address your anxiety with the equal effort that you're studying. Because I'm telling you, if you're just studying, and trying to gloss over or ignore the anxiety or like try to hurry up and get over it without addressing it, that's going to be key there. Difficulties concentrating. This is another one that I found with working with various and diverse social workers who are trying to pass the exam. I have found that some had a lot of difficulty before they addressed their concentration. Like they needed medical intervention for their concentration, right? And they're just thinking, oh, I just have anxiety, you know. But if you have difficulty, again, I'm not giving medical advice. I'm just letting you know what I've seen. I'm not saying it's you. I'm just letting you know that it's a thing. And if that's something that you struggle with, that you may need to just investigate a little bit more about how you could maybe address it. There's also, again, do anything without checking with your doctor. But there are different supplements that you can also take to help with concentration. So I'll just say that. So you may want to like over the counter stuff that you can take. What is that? I will put it in the chat so I won't be liable on the video. But that's what it's called. Okay, so preparing for the exam, you want to prepare early. Yes, taking breaks, absolutely. Let me see. Oh, remember to take breaks. Overstudying. Yeah, overstudying can lead to feeling anxious. Yes. Yeah. So you may need I'm going to tell you about what to do when you're in the exam, but also before you get to the exam, taking breaks. Yeah, it's good. Systematic desensitization. I wanted to use one of our social work terms, but basically being able to be exposed to your anxiety so that you can address it. So the more you can be anxious, hopefully the better you can use your techniques, your relaxation techniques, breathing techniques. And there are so many different apps that can help you. So I named some here like Headspace Calm, Breathe to Relax, different ones. You can do the the sound bowls on YouTube. It was some music that I listened to when I would be in like a virtual waiting room, and it was so relaxing, but I could never find the name of it or like find it on YouTube, but it was so good. And all the other ones annoyed me. I was like, oh, finally some relaxing music that makes me relax. But I don't know. I don't know the name of it. But play around with different things. If meditation is something that you like to do that more. Rain and thunderstorm, yeah. So are you someone that can listen to something and study? Because maybe you could play it while you're studying, or maybe you could just play it before you study, having that grounding techniques. I'm not a clinician, but grounding was something that all my clinician friends say are good in terms of being able to know you're in a moment, know you're having this anxious moment, and be able to settle yourself, right? Making sure you know techniques to do that. Sometimes writing things down may help with your anxiety. I know it does with me, especially if your thoughts are irrational. But I'm saying irrational, but they're rational because especially if you've gone through some experiences. But be able to know that, hey, you telling yourself that you're going to fail is actually an irrational thought. You don't know that. So you don't want to just set yourself up like that. And then work on minimizing your need to be perfect. I put that in there for me. You want to make sure you get a good night sleep and get a nutritious breakfast, or don't eat anything at all, depending on what time you're going to go there. The day of the test, you may want to arrive early just to make sure you know where it is. And then if scriptures don't work for you, you could select one or two positive affirmations, or in addition to the scriptures, to rely on during the test. You want to have some type of strategy to calm yourself down during the exam. I was not calm all 4 hours. I probably was calm for maybe 3. So the first hour I freaked out. And then throughout it, I probably had mid anxiety, but it wasn't so bad that I couldn't concentrate. I was able to still perform. Some common mindset errors. Common mindset errors. Not facing your anxiety, right? Not taking advantage of test accommodations. So it's not for everyone, but if it's for you, look into it, right? Having an extra hour may be the difference in what you need. And so that's something I typically ask when someone has had some failed attempts. I'll ask, do you have an accommodation or have you thought about having an accommodation? Is timing an issue? That's something I also ask. Were there things on the exam you felt unprepared for in terms of your knowledge? Typically, the answer was policy or macro. That's typically the answer when I ask that. I also ask, was there any second guessing or anxiety that showed up for you? And so those are some of the things I ask when someone has a failed attempt, just in terms of just understanding what the experience was like. Becoming overwhelmed with statistics or becoming discouraged when you answer multiple questions wrong. This is something that everyone does. When you get a question wrong, you automatically beat yourself up. So what I would say is catch it and then fix it. So if you say, oh my gosh, I got another one wrong, don't say that. Say, oh, that was a good learning opportunity. Let me see what I can learn from this question that I got wrong. Okay? So you keep making sure that you are reframing your thoughts all the time. Take back control over those thoughts. Even if you don't believe it, just say it, right? Just say, it's a learning opportunity, fake it till you make it. And so you start believing what you're saying. Intellectualization is, again, being too intellectual, thinking a little too much into things. So you want to make sure you're not doing that. Second guessing, not building up your confidence, which leads to changing your answers. And then not inviting your support system. I get it. You don't want everybody to know. And I'm not saying everybody should know. Some people say, Dr. Boone, you're the only one I'm going to tell my date to. I'm fine with that. But there might be some support that you need. We talked about supervisors, but sometimes you might just need that person that makes you feel better. So you might just need them to tell you that you're the best. For me, that's my grandmother. Like, my grandmother celebrates me. It don't matter what I do. What you do today, baby? I drove to the store and you are a great driver. She just, you be like, I'm a great driver. Oh, you. So if you have that person in your life that just makes you feel better, gives you that like positivity, sometimes you just need to be around positive people, then do that. It might be, hey, I can't go out with you because I have to study, right? Some of those things you had to do when you were in school, boundaries, like you might have to put some boundaries up. You might say, hey, I do need your help. Not with if your supervisor said, what can I do? You can't ask them to babysit your kids. But if your friend asks you, what can I do? You can say, take my kids for a night so I can study by myself, or whatever that looks like for you. Don't be afraid to engage your support system to help you. Okay. You can even have your kids or your spouse ask you questions. Let me tell you what is irritating. And my husband normally joins all my lives and tells me how great of a person I am, but he's driving. But let me tell you, when he looks at a question and he be like, oh, the answer is this. Irritating, right? Doesn't it irritate you when you studying and you're a person that's not a social worker and gets it right? And you be like, you know what? Leave me alone. Right? But use them because they might be able to help you see, well, you're looking too much into it. Yeah. Yes. Yes. And I'm gonna keep and as we work together, I'm gonna say it to you in such a professional way, but I'm basically gonna say we don't care. Right? Some of the things we go through a whole spiral of, well, what if this, what if this, what if this? How does this work in real life? All of that stuff, even though we're social workers and we like are really good at being a social worker for the exam, we just don't all of that stuff. The what if, what if, what if, what if, it's sometimes it's good to process, and then most times it just has nothing to do with the question. So you need that. You need somebody to be like, you're too deep, come back, reel you in, reel you in. And sometimes that could be people that you're around. Use of affirmations are really good. So make sure I have some here, but I'm serious about this, y'all. I want you to write down your name with the letters behind it. I want you to like say these things to yourself. And coming from somebody like me, who is not although I just had an emotional moment and did tear up, but in terms of being more logical versus being emotional, I'm on the logical side. So these like touchy feely, clear your mind, relax. Like I don't do any of that stuff. But let me tell you, this works and you need it. Sometimes the things that you don't normally do, you have to do them because you need the positivity. I love these. I can, I will, I must. Be consistent, be disciplined, be you. Yeah. And you are enough. So if you're having those thoughts, make sure you are reversing the thoughts you're having and make sure you're catching them. Because again, sometimes they're just so common. We just say things and. Okay, how to regroup for those who have had a failed attempt and want to regroup. Sometimes you need time to process. We know that you can do the waiver. For most states, you can do the waiver. They give you 90 days if it's more than 10 points, or if you're not able to do the waiver. And sometimes you just need time to process. Like I know typically people will reach out to me as soon as they fail. But sometimes you just need a little time. And it's okay to feel all of those low moments. It's okay for that. But then after you are determined, and let me tell you, some of you are very determined. I've worked with people who have taken, the most I've seen is 15 times, right? So that's a lot of money, like we talked about earlier, but you're determined to be committed to your career development. Yeah. So it says, why is it 90 days? That's so long when you're focused. Yeah. So the reason, and I've talked to the CEO, the new CEO. Well, she's not new, but the most recent CEO. Not like I talked to her personally, but she did a town hall. And basically, the thought process is the 90 days is so that you can study, because what they're basically saying is that you failed because you didn't study enough. But we know that with all of the advocacy around the exam, that it's probably not that. So we're trying to change that. But for the time being, yeah, and it's not always the case. Yeah. So yeah. Some jurisdictions, some states, like Maryland is one of them. If you hit below 10, if it's 10 or less, then you can waive the 90 days. And I don't know if that's all states. But I know it's 10 points or less, you can apply for a waiver. And they'll give it to you automatically if it's 10 points or less. Yeah, Maryland does the waiver. I'm not sure if all states participate in the waiver. But I believe there's a section on the website that will let you know if you are eligible. Yeah, 11. Yeah. I have many feelings about the exam. So sometimes you need to take a break from studying and thinking about the test. Yeah. Ask yourself, these are some things I already talked about that I normally ask people. And you may not need new or additional material. Sometimes people buy new material every time. You don't need to do that. Really think about what it was. And it, again, might be anxiety, or it might be just you need to sharpen your test strategy and not learn more. right? It's more about your strategy. So give yourself 2 full months to study. This is again for those that choose to or that have the 90 days. Spend more time in addressing your anxiety. Yeah, got to. Okay, here are some free study resources. There's a Facebook group. There's a Quizlet, 2 Quizlets. There's the behavioral health app. This is this app icon right here. Then there are different YouTube channels. So ones that we haven't mentioned yet are Dr. Pam Turner. She has free, and then she has boot camps as well. I think she has a discount running on her boot camp. Then we have me. Then we have Phil Luttrell. Some people love him. You have Savvy Social Work. A lot of people love her. RayTube. And I think there's another person that does the Clubhouse or something, and it's free study groups. Also, oh, I don't have it on this one. But TED Talks. TED Talks is also free. He does his study groups on Sundays. So it's a free study group on Sunday. That could be your study time, you know, for that day. And he also does one-on-ones with availability, and that's also free as well. So he's really good. Yeah, so last week we went over to who does the one-on-one. I'm gonna send, while we're looking at this question, we're just gonna do 3 questions tonight before we leave. But while I'm letting you all look at the question and give the answer, I'm gonna get his information because you can sign up through his Instagram. Okay, let's do this one together. The social worker's first responsibility is to a 16-year-old is seeing a social worker in a local homeless shelter for teenagers. She states that she's pregnant and has been vaping quite frequently. The client ran away because her parents were extremely critical about her getting pregnant. The client wants assistance with employment services. The social worker's first responsibility is to. So remember, when we do the like method, we're going to read the last sentence first. We're going to identify the type of question. We're going to look at what concepts are important, right? The key concepts. We're going to eliminate it down to 2 answers, depending on if it's 4 or 3 choices. And then we're going to identify our distractor and go over all of the other steps again, just to make sure we're on the right track. So our type of questions, there are many type of questions. So tell me, what type of question is this? What type of question is this? Assessment, okay. Safety. Okay, let's go with those 2. So what I will say is, if you believe this is a safety question, then, okay, safety is always first on the exam. Okay, yes, because when you think about the order, it is safety, This is for first and next question. Safety feelings assessment, right? But we have to make this is one thing that I feel like is also a common error is you have to make sure it is really what you think it is versus you making it, right? So I will say there is a safety component, right? Because we're a little bit concerned. And when we're concerned, we're typically in some type of a safety issue. So it does look like it's a safety question, but a safety question would mean that we give a safety answer. So the reason why it's not a safety question is because our answer is not a safety answer. So um, A is not correct because, no, actually the answer is B. Assist the client with prioritizing her needs. Let's go over why it is this. So I agree that it is a direct practice question because you can't assess the safety of the unborn baby and inform child protective services because the baby is not um I won't say alive. It is alive, but it's not outside the body. So you can't remove a child from the uterus. So that's why we can't report. There's nothing that can be done while the child is still in the body. But we can, of course, document. But of course, it doesn't say anything about document. But I'm just letting you know that it's not that we don't think there's an issue, but it's just no safety actions that we can do. Right? Because in order to keep the baby safe, we need to keep the mom or the teenager safe. So really our focus is going to be, and our client is going to be the 16-year-old, making sure that we are addressing, what needs she has so that we can deal with that. So if it has said, well, let's address the vaping or let's address those things that we have issues with, then that might be the answer. But we don't have that. We have A, B, and C. Someone tell me why, and you can just put it in the chat and those on Facebook. Tell me why it's not C. What in the scenario would tell us that C may not be the first thing we should do? She ran away. Yeah, I'm gonna go with that. Yeah, she ran away, and her parents are extremely critical. That's why she. Yeah, C is not. Let me see. C is not because that would hinder the relationship with you and the client. Definitely. That's another thing. I don't know the breakdown of what type of question. Maybe that's my barrier. It may be, but I wouldn't go with that. May not be your barrier. Confidentiality. Okay. They would have already contacted the parent because she is in the shelter. Okay. Right. Locating parents will not assist her with her issues. Yes. And locating them might cause trauma. Yes. Right. So if the 16-year-old is the client, and we're not saying that we're not going to locate the parents, but we're just saying that what is our primary responsibility and focus with what we have, right? So with all first questions, it's not that you wouldn't do any of these except for A, really. But it's more about the sequencing, right? And so assisting the client is going to be a little bit more important than locating the parents. It's not that we don't care where the parents are. It's not saying we're not going to reach out to them, but it's just that that's not what we need to be doing right now. Right now, we need to focus on the client we have in front of us and the problems that she is experiencing, right? So we can help her. So that's why the answer is B, assist the client with prioritizing her needs. And I wanted to also address what Monique said. Well, I didn't know what type of question it is. Maybe that's what's wrong. And I would say if you were able to identify that it was not a safety question, then that's just as good. Even if you didn't know, okay, this is a direct practice question. As long as you didn't say, oh, this is a safety question and I need to give it a safety answer, then you're in the right realm, right? You're in the right uh section. Okay, I'm gonna get the Instagram now because I was having trouble locating it. It's in my other slides, but if I try to find it in my other slides, it's gonna take even more time. So I'm gonna go on Facebook, find the link for TED Talks for his services while you all look at number 2. Okay, I found it. All right. Yeah, he normally does Sundays is normally IG. Just that's the IG. Once you get to the IG, you can click it and it you can click his bio link and it'll subscribe you, I think, to his group. He also he also has a TED Talks uh social work group. It's 100% free to attend. I'm not sure if he uses the same Zoom every time. I feel like he does. But yeah, that will give you more information and you can reach out to him about the individual as well. I think he has like a form to fill out. Okay, what type of question did we feel this was? What is the best action for the social worker to take? What do we think? Application, okay. Yeah, I would say direct practice because it's really about our setting, our role. Um, yeah, so I would say direct practice. What is the best action for the social worker to take? When it says best, oh, it's like best according to who, right? So sometimes best could be also first, but it's basically saying that based on the scenario, what is the best action? And it's sometimes going to be based upon some type of knowledge that you need to pull from. But because it's practice, it's probably going to be best in terms of where you are in your either stage of practice. And this actually has a little bit to do with your role, actually. So, a hospital social worker attends a case conference on an 85-year-old patient who recently had surgery and only has a few months to live. During a meeting with the patient to discuss discharge planning, the social worker finds out that the patient was not notified of the prognosis and diagnosis. And let me tell you, you're going to think, what? Why? What in the world? And wants to know more information about the surgery that occurred, right? Terrible bedside manner. Okay, so but sometimes that's the reality. What is the best action for the social worker to take? We are not doctors. We cannot disclose medical diagnosis. Yes. The question never mentioned family. All right, it's good to know too. B, we can't do that quite yet. And A, not our job. All right. Yes, A is a never. I had a question on my Instagram and it said, what if, and this was something that somebody asked me, what if the client asks you about a medical acronym? So when I say stay in your lane, I'm not saying that you cannot provide any information. Right? If there's an acronym or if there's something that can be explained, like you know how when you it's really called like I'm trying to think of a we just gonna go with C-section. I mean, it's not a real life thing. But C-section, what does that mean? You're like, oh, it means a cesarean, right? But then if they ask you something else about it, like, oh, well, what are the risk complications of that? Okay, then you can't go there, right? Um, so the answer is going to be C, assist the patient in developing questions to ask the physician, right? We can assist, we can definitely assist with that. I think learning the role of a social worker in different settings is important, absolutely, and helps answer the question, absolutely, right? There are some limitations that we as social workers in practice looks a little different than it does on the exam. On the exam, it's like big limitation. It's like, don't even think about it. The exam is like, don't even think about that because that's not your role. Right. Yeah. So you got to learn your role in different settings. Yeah. And not even just different settings, but what is your primary focus in these settings? So hospital social workers, their primary focus is not really the diagnosis and prognosis, but how is the client going to function, right? With discharge, or even are they having any needs because of this diagnosis or prognosis? Is there a basic need that needs to be met? And then we're going to probably refer out to something. Meetings. We love having meetings. We love having meetings. But B, again, had nothing to do with discharging, right? It had something to do with the client has a question. And so when a client has a question, when a client has a request, when the client is asking something, we should give an answer that has to do with what they're asking about, right? So B just had nothing to do with what they're asking about. So that's why it's not B. But we love a meeting and we love to do that. Okay, 3, this is our last question before we part ways. And then I'll tell you a little bit more about my services. I like it. Yes, human behavior, absolutely. And what information um do we need to know about human behavior? Name and stage, psychosexual. Come on, come on. All right. So when we have our developmental stages, right? the reason we need to know the information in this instance in particular is to say, is this normal or abnormal? So let's start with that, because once we know whether this behavior, right, and the behavior is the student pinned down a classmate to the ground and began to imitate sexual intercourse. Right. So is that normal or abnormal? According to psychosexual stages. All right. Yes, it's abnormal. Perfect. Because there is a curiosity that happens with the psychosexual stages, but there's no curiosity that would have a child imitate sexual intercourse. That is not a learned behavior. Sexual intercourse is not a learned behavior. I mean, it is a learned behavior. It is not a normal exploratory development, right? Some of our normal exploratory development is going to be during our which stage does the exploration kind of pop off? Yeah, our genital stage, yes. And it normally happens a little younger. And during the genital stage, that's normal, right? If you see some preschoolers touching themselves, they're trying to figure out what everybody has down there. They're talking about it a lot. Those types of things are normal. But even at that age, this would not be normal. So at 7, at no age is this really normal. Okay. So we need to know anytime we see a client that has been, okay, question. Sheila said, if they look and touch, it's normal. During that stage, right? During our preschool stage, I can't remember the exact age of it, but it's preschool, right? So it's like 3, around that age. Somebody's going to tell me the real ages because y'all been studying. But that is normal. Right. Yes, they're discovering themselves. They're finding out that different ways they touch themselves gives them different sensations, right? They may try to touch themselves some more to get the sensation, right? All of that is normal. They're trying to figure out what they have, what everybody else has. They may try to figure out what other people have, right? So you might take down each other's pants, all of that. Phallic stage. Okay, perfect. Yes. Correction. Phallic stage 3 to 5. Phallic stage 3 to 5. I should know. I teach it so much. But the focus is their genitals, right? The focus of that phallic stage is their genital area. So that is normal. Okay. But but sex means they've seen it. Yeah. Or any sexual explicit verbiage, like if they're saying certain things, that they've been exposed. It doesn't mean that they are being sexually abused necessarily, but they've just been exposed to some sexually explicit things that they have learned or have heard or have seen. So we have to figure out as the social worker where that is coming from, right? So that's typically what we mean by this. So when we have our stages of development, we want to know, is this behavior normal according to our theory, or is it abnormal? If it's abnormal, then we might be concerned, and then we need to figure out what we're going to do about that. Okay. So we can actually get rid of any answer that says it's normal, which is definitely D. Reassure the parent that this is normal exploratory sex play. It's not like that's not normal. Okay. So we're going to get rid of that. Then we have, then when we look at what we're left with, we have complete an assessment with the parent to determine if indicators of sexual abuse are present. B, tell the parents that the incident must be reported to Child Protective Services. Or C, file a bullying incident report with the school. And remember, it says, what should we do next? So we kind of have to see where we are in the process. So far, we have a teacher referred us, we contacted the parents, and the parents are also very concerned about the behavior, right? So we want to put these in order, A, B, and C. We want to put them in order from last to first. So if you had to put A, B, and C in order from last to first, what would your answers be? B, A, C. Okay. Okay, so I think is that first to last or last to first? Oh, it might be okay. That might be last. Is that last to first? B, A, C. Okay. C, B, A. Oh, how we put D back in there? I thought we got rid of D. Okay, so I would say that we don't have enough information to make a report, right? Tell the parents that the incident must be reported to Child Protective Services. We don't have enough information to know that there is something that we need to report, right? Because we have to know the who and the what. So far we have a behavior, but we don't know where the cause could be. And so we just need to get a little bit more information. File a bullying incident report. It's not really our focus. Like we probably could, but we really are concerned about this concern. So C really doesn't have anything to do with what we're focused on. So I would say actually D and C, we could just throw those out. Those aren't even really have anything to do with what's going on. So now we're left with A and B. So it's really about, do I report or do I get more information first? Because remember, next is like, what do I do next? Meaning first next. So the answer is A, complete an assessment with the parents to determine if indicators of sexual abuse are present. So you're trying to assess, because if something ain't right with them parents, their explanations ain't right, or they, seem a little off, or it might not be the parents. It might be a family member. If they kind of give you some information that it's been some maybe inappropriate things happening with family members or something like that, then we're going to report it. But we just want to see where the exposure could have been from. Because honestly, kids may, and obviously you would also probably talk to the child too and just see, where they got it from. But sometimes it's not a child abuse issue. It's just they were looking at the wrong things kind of issue. But we want to make sure that we are getting the information. I thought we are mandated reporters for such incidents. Yes, we are mandated reporters. And so again, but on the exam, you have to have the who and the what. So we have to know a little bit about what happened. Like, let's say somebody discloses, hey, this happened to me, we report it. That one's easier to see. This one, when we don't really know what's going on, and I'm not saying that you're doing an investigation, obviously. An allegation is, a suspicion is a suspicion. So if you have a suspicion, then you report, right? But this is just saying, let me try to figure out what else is happening to see if there's something else going on, and that's why this happened. It was reported to us by a third party supervisor of the children. Right. I know that the incident happened, but I'm saying in terms of, so child abuse, it means, because there's different things at play, and I kind of get what you're saying. When children assault each other or do things to each other, there is a system for that, right? Could be something in school. Sometimes you can get the police involved. with things like that. The child welfare system is for adults abusing children. So if we're going to report it, it has to be not because the incident between the child on child, right? We're looking for are the parents involved with some type of sexual abuse that's present? Like, is the child acting out something that they are experiencing or is happening to them? So really, you are just trying to figure out, is there any concern for sexual abuse? Because that's when you report. So you're not reporting just because, okay, this happened on the playground, right? You're reporting because you're trying to figure out, is this a behavioral indicator of sexual abuse? Yeah, because it could have been something they saw on TV. Absolutely. Yeah. The parents were also concerned. Yeah. So it kind of seems like we're on the same page. It's not like they're like, oh, that's normal, or, oh, don't talk to me. I don't want to talk to you. Well, they're not avoiding the subject. They're actually concerned themselves and they want some help with it. So it kind of seems like they're okay, but we just want to know in general, is there any indication that any sexual abuse may be happening? And of course, you're not going to say to the parents, hey, I'm looking to see if there's indicators of sexual abuse here. That's not what you're going to do. You're just going to ask some questions so you can see what's going on. But because we don't know the who and the what, this is what I want you to come away with this. Because we don't know the who and the what, we're going to get some more information before reporting. So I'm not saying that you would not report this. What I'm saying is that we just want to know where, if we can find some information about the cause, and it's something that we can clear up easily, then we probably don't need CPS involved. But if the information that we get is not clear and we still have concerns, then yeah, we're going to do that reporting. So the exam just wants you to know that before I report, I got to ask some questions. That's all it's saying. I'm not doing a full investigation. I'm not saying, hey, child, you can't go home because your parents are doing something to you. I'm not doing any of that. I'm just simply trying to get more information so I can assess what it may be the cause or what things may be at play here. Right? It's kind of like in my state in Maryland, we get calls because fingernails are dirty. So it's not that type of mandated reporting, right? We're still mandated reporters. And again, we're not saying we're not reporting it. We're just saying before we report, we're going to get the information we need to actually make the report. So we're just asking follow-up questions to just make sure that this is really something, a suspicion. It's really a concern that we should be contacting them about. So wanted to make that clear. But guess what? When we have our class on ethics and safety, it's going to become crystal clear, I believe. You're going to be really clear on when to report and when not to report. So that's something that we'll definitely be going over in our classes. I'm just going to bring up the class schedule really quickly and just allow you to see what classes we have coming up. I did have a question. I did see the purchase that went through while we were talking. Thank you so much. And so once you make your replay bundle purchase, it's not, I don't have the system set up where it's automatically enrolling you into the classes. So I have to manually enroll you into the classes. So like for those that made a purchase like earlier today, I just went ahead and put them in. But those that are as you go, I'm gonna add you. So don't be concerned. If you're like, oh my gosh, I don't know what happened. So May 9th. So by May 9th, so what happens is once you purchase your replay bundle, I'm gonna manually enroll you. And then once you're enrolled in the class, you'll get an email in the morning. So on the morning of May 9th, you'll get an email and it will say, it'll give you the link, and it'll also give you the handout for that day. But once you're registered, you have the Zoom link in your email. It's going to send you a confirmation. And I forget what the button is, but it's a button, and I don't know if it says join the class or something like that, but it's a button that has the link in it. So that confirmation email you get, it always has the Zoom link. So if you ever are like, oh my gosh, I don't have the Zoom link, it's there. But you can also email me and reach out to me for the information as well. And I always send it the morning of. When do we have to get payments in by? So it's really up to you. The deal is the deal all the way throughout. So for those that joined us like mid-cycle last time, so you purchased the bundle, maybe it was not until, we were already on our second set of, the end. You get the 6 classes no matter what. For anybody that purchased it in 2024, you get 6 free classes. So it's just up to you. If you want to get all 6 free this cycle, then go ahead and pay, by May 9th, and then you'll get enrolled into the classes. Once you get further along, then, you'll have to wait until the next cycle. So no class on 5/2, correct? Right. Yes. No class on 5/2. We're taking a break, and then we'll start back up ethics and safety on May 9th. They are recorded and they are sent to you. I sent it to you. We have a class on Thursdays, and I sent it to you by Saturday morning. Just email me. We are late. Do we get the ones we missed? Yes, you do. Mm-hmm. Yeah, I tried to recoup, but I probably missed some people from last time. But I tried to get the ones that, like, I can see which ones you already got for free, and I tried to, like, let's say you only did 3 last time, then I try to put you in the other 3 this time. So just email me if you're like, hey, Dr. Boone, I didn't get my classes. Just email me and let me know. And my email, I'm going to give you both of my emails just because my Outlook has been doing some weird things. Like sometimes people don't get my emails, so I'm going to give you my Gmail as well. And again, buy the repaid bundle for $79 and get 6 classes all for free. And the normal drop-in rate is $30. So it really is like a really good added value. I try to make sure my stuff is affordable because we know it's like a lot with all of the fees. I have to renew this year, and I just know it's going to be renewal is a lot. Any other questions? I had a really good class. Sometimes we have like these really touching moments, and I can remember the last time we had one like that. We literally like I had one of it was during a live study group. So most of the group I'll keep you on mute just so that when you play the recording you're not annoyed. But at the end we do unmute and we kind of talk, and I stay afterwards just to see if anybody, had any questions. And then so one of the times it was similar to what happened. She was talking about how she feels. She really was upset. She really was looking forward to passing, and she just was feeling really bad. And then um she was feeling really bad, and then we were all crying. And then she and then she we then she told me she passed after after that series. So, that touching moment, I don't know if that was what it was, but sometimes you just need that. Do you know when you complete the exam application? Do you get the documents before or after you test? Complete the exam application. Okay, give me a little more what you mean. I purchased a live class. Do we get study materials? Yes. If the question is, so every time we meet, you get the handout. But if you're saying you purchased the live classes and you want the replay bundle to go with it, just email me. Because either way, we want to make sure you're getting what you need. So just email me. Okay, meaning, do you send in your fingerprints and transcripts before or after the exam? The transcript is going to be after if you're in your last semester. So let's say you already applied before you graduated, then your transcripts will come after you graduate. And so you can do that after the exam, or you can do it prior to the exam. Whenever you graduate and it's on your transcript, you can send that in to go with your application. Oh, I graduated to 2014. Yeah, so you can do the transcript whenever. And then your fingerprints, you can also do that whenever. Basically, they won't give you a license until you have those things. So whether you give them that stuff beforehand, before you take the exam, or like when I took my exam, I passed, and then I did my fingerprints like right afterwards. So that it's all, coming in together. And it also depends on your board. Like if your board is a little slow, then you might want to do that before the exam. And, because yeah. Yeah, if there's anything you have questions about, please feel free to reach out. Um, you're welcome. You're so welcome. I had a great time, and we will see each other soon. Oh, I submitted the application. Will they reach out to me to schedule to sit? And it's in Maryland. Yeah, if you submit your application, you need to see if it got approved. So you can log back into your portal, see if it got approved. They should also email you your approval. Once you get your approval, then you will get instructions on how to register for the exam. Once you register and pay the $230 for the exam, once you register and pay for the exam, then you're able to actually schedule it. So you have to pay in Maryland. You have to pay before you can actually see the log in and schedule your exam for the date. But if you have more questions, just reach out to me offline, and I will see you. Yeah, it's okay if you feel good. That's good. I want you to feel good about the test. Yes, that's good. So I will see you on May 9th. We're gonna take a little break, and I'll see you on May 9th. Make sure you're doing all the things we talked about tonight. So when I see you on May 9th, I want to know, what are your calming things that you're gonna do? What's your strategy for calming yourself down? If you decide to really pursue some more serious things about your anxiety, do that before May 9th. I want you to be serious about that. Also take the learning style quiz. Go ahead and make sure that you're prepared. Print out the code of ethics if you want, so that when we go over it, you can make notes. Just get yourself prepared. Go ahead and start studying the code of ethics for this next week, to prepare for May 9th. Okay. So I'll see you then. If you have any questions, please reach out, and I can't wait. Have a great time. Yay. Good night, everyone. Have a good night, everyone. I will see you on